Study by the Suid-Afrikaanse Onderwysers Unie in conjunction with Northwest University has found that teachers are increasingly using support programs to cope with stress. According to News24, it's also revealed that over 30 Gauteng teachers were admitted at a wellness centre in August as a result of stress-related illness. Let's unpack the story further and bring in Sibongile Monareng. She's the Director for Psychosocial Support at the Department of Basic Education. Sibongile, it's great to talk to you. Thanks very much indeed for coming on. And yeah, I want to reference that article by News24 again. As we mentioned in the intro, 18 of these 32 beds at this wellness centre in Gauteng occupied by teachers who were admitted for stress-related problems. And then News24 also telling us that 6 of the 12 matric teachers at a high school in Escort in KZN were also using antidepressants to cope with stress. When you, as the Department of Basic Education, hear numbers like this, indicative of the kind of stress teachers are under, what do you make of that?
So, Michelle, actually, this is one of our big priorities as a department. Educator wellness is very important to us. We know that in order for our learners to succeed, we actually need the educators to be well. There are several studies that we are aware of that have been indicating the need for additional psychosocial support to our educators. And I have to say, Michelle, that it is a global crisis. Actually, it's not just in South Africa where we're seeing that more and more educators are expressing feeling overwhelmed and needing additional support. There are multiple factors that cause educators to feel overwhelmed. All of us, for instance, are feeling the economic strain. So they would not be spared from that. Right, so there's the economic strain that they're feeling, and there are then other multiple factors, perhaps at a school level, that may be causing increasing pressure on them. But it's something that we are working on, even from the COVID period, which made it very clear for us that there was a need for specific interventions to support our educators. Michelle, I do have to say that this does not take away from the responsibility of HR or EAP programs, right? Like in any employer-employee relationship, there is that EAP program. However, from the COVID time, we are putting certain things in place to support our educators, which I'm happy to talk you through.
Yeah, please. We'll get to that in a moment. But, for teachers in particular, and perhaps the argument can be made that there are a number of industries where people need support to try and cope with just the pressure of working, of having maybe a crisis in your personal life, of, just getting on with life. But for teachers in particular, it's such an important sector in society. The workload is immense, right? They are trying to lead these students through important phases in their lives, and they've got a lot on their plates just in terms of teaching and learning, preparing tasks for students, marking, doing reports, and the list goes on and on.
So, yeah, you're right. We do know that workloads have been a problem for our educators, particularly the administrative workload. And the department is currently working on making sure that there is a reduction on unnecessary administrative burdens to our educators. And we learned a lot. I'm going to reference the COVID period again about the curriculum and what works and what doesn't work for our educators. So there is an ongoing process of making sure that educators are not spending unnecessary time on administration as compared to time with learners. Research does tell us that educators, it doesn't increase an educator stress if they spend more time with learners compared to if there is added unnecessary administration. So it is something that we are working with provinces on to make sure that we support our educators as much as we possibly can.
So how has that worked? Because I think I might have had this conversation with you or perhaps another representative from the department some months ago about trying to lighten the administrative load on teachers. How has the progress been going on that?
There's progress, and remember, Michelle, we have quite a number of schools in the country, over 24,000. So there is progress. Perhaps there are figures that can be given to you, but it's definitely something that we are working on, and that is being monitored by our Director General and our monitoring and research team as well.
Yeah, I can't imagine that the kind of stress that teachers feel just in trying to do their everyday workload is made any better by the fact that there's also talk about job cuts in many provinces.
Yes. However, there is that, Michelle, and all provinces making sure that whatever intervention they are working on to address the budget issues is going to be as minimally disruptive as possible to the system. So different provinces are putting different interventions and strategies in place. If you remember, the MEC for Education in Gauteng had a media conference yesterday to present the province's plans. So different provinces are putting together different strategies, but educator wellness is definitely one of the priorities of the department, because we know that without them, actually the department wouldn't be able to function.
So tell us more about these tools that are available to teachers who are struggling and who need help.
So one of the projects that I'm actually currently overseeing is we're finalizing development of a telehealth platform it's going to be a virtual platform that will provide not only information on mental health and referral for services, but it will also provide counseling support to our educators, our non-educators, as well as learners on mental health. We are planning to launch the platform early in 2025. This is one of the biggest things, Michelle, in the country is still the stigma related to mental health, and really the limited understanding of mental wellness in general. So one of the things that we're going to do through this platform is to educate our educators about mental health wellness and provide them with information and tools, as well as referral support for when they need counseling. We look at this as a preventative strategy, rather than more a reactive strategy, because we know that there's a need, and we are hoping that through that support that the department will be providing, we're going to see more reduction in educators that are presenting to hospitals for long-term admission, unless really it can't be avoided. So we really are looking forward to launching the platform, and we think it's going to make a big difference. Because we also know that the Department of Health doesn't have adequate mental health support resources. So we're working together with the Department of Social Development and Health to make sure that this platform is available, and we're going to be working with other stakeholders, including medical aid providers as well.
Sibongile, and I imagine you would predict my next question is leading this way, but this is not a new issue, right? And this is something that should have happened a long time ago, the launch of the system.
Yes, Michelle, and like I said, globally, mental health has not really had the resources that it needed to have. And over the last 2 years, we are seeing a bit of a shift in resources for mental health support. So even now, to actually develop this platform, we've had to work with non-governmental partner to assist us with funding. So it's really a resource challenge that we have, not just in South Africa, but globally, towards mental health resources. So, but it's something that we continue working on. We are continuing to lobby for more partnerships and support. I agree with you. That's why we also, because it's not just the availability of the services, Michelle, it's the demand for the service. The issue of lack of information about mental wellness, how sometimes people end up at hospitals because they didn't know how to put in place coping mechanisms for coping with just life in general. So we're going to really promote mental health wellness so that we avoid our educators and our learners needing admission. So we are understanding it's a resource issue, but it's also an information issue, Michelle, because how many people have a plan for their day-to-day mental wellness.
Yeah, absolutely, and that's something that applies just across society, right? It's not something that's limited to education. And what a shame it is that mental health is put on the back burner in the way that it is in some cases. So in terms of access to these tools, Sibongile, would you say that there's enough awareness in rural areas? So for example, would you say that the teachers who are in city centres like Johannesburg, Cape Town and so on, that they will be more aware of the tools available to them and that they will make use of it compared to a rural area in our country?
There will be. And so, Michelle, to ensure that, we even internally here at the department are engaging with different colleagues. So, for instance, we're going to be meeting with colleagues that look after specifically educators and learners that are in rural centers to make sure that we're going to have measures in place to market the platform beyond the urban areas. And Michelle, we're also going to monitor ourselves. We're going to be producing reports on access of the platform, who's accessing the platform, and of course it will have anonymity, but we should be able to pick up geographic locations and some basic things that are going to tell us about the utilization of the platform. So we're quite aware that how we market the platform in urban versus rural centers is going to have to be slightly different, and we're going to be working closely with our colleagues from communication as well, so that when we do launch the platform, we launch it appropriately to reach all the stakeholders in the sector.
Yeah, and let's get the teachers who are so important to our country the help and the support that they need. Sibongile Monareng, let me thank you for your time this afternoon. A pleasure talking to you. She's the Director for Psychosocial Support at the Department of Basic Education, as we talk about teachers being unable or finding it very, very difficult to cope with their workloads.